For joining us today. I'm Carlene Ketela, CEO of the Michigan Academy of Family Physicians. This week is Family Medicine Week in Michigan, a time to recognize the role that our family medicine physicians play in keeping patients of all ages healthy, especially now during this global pandemic. Family medicine is a specialty that provides first contact, comprehensive, continuous coordinated healthcare for individuals of all ages and families. The Michigan Academy of Family Physicians represents more than 4,200 family physicians and family medicine residents and medical students across the state. As family physicians play a key role in all Michiganders' lives, we are here today to urge the state to include family physicians in the vaccination process. To speak more about this issue, I'm going to turn it over to Dr. Mark Hamed, President of MAFP, Medical Director of the Departments of Emergency and Hospital Medicine at Mackenzie Health System, and Medical Director of Health Departments in 8 Thumb and Northeast Michigan counties.
Hi, good morning, everybody. Thanks for joining. My name is Dr. Mark Hamed. I'm the Medical Director of the Mackenzie Health System in Sandusky, Michigan, in the ER in the hospital, as well as a physician at Henry Ford Health System. And I'm over 8 counties in Michigan, including Sand Lake, Tuscola, Huron, Lapeer, Alcona, Iosco, Oscoda, and Ogama counties. And I proudly serve as the president of the Michigan Academy of Family Physicians. So it's been a long year of caring for our neighbors and our patients during this public health crisis. And family physicians have been working hard to protect our patients and to fight and prevent COVID-19. The progress made has been excellent on vaccinations. It's encouraging. We've still have a long way to go to help protect all Michigan's residents. Now that we're nearing the time for the general population to receive vaccines, it's absolutely essential that the state of Michigan include primary care physicians in this effort, because this really is our shot. So the demand for vaccinations is just going to get higher once the general public is eligible. Family physicians are ready, willing, and eager to help out. So we're encouraging the state to allocate vaccines to primary care physicians across the state so that we can really administer these COVID vaccines to our patients. Because the quicker we can vaccinate our patients, the quicker we can reach that herd immunity that we want. So the spread of COVID becomes unlikely and inevitable. So by mitigating the spread of it, by getting on top of it, we get ahead of the various strains of it as well. With the help of family physicians, the state's capacity to vaccinate people will just grow exponentially, helping us end the pandemic faster. That's why I support this, our national shot campaign movement, to elevate vaccines in the voices of healthcare heroes like family physicians, to build vaccine trust for a COVID-free world. With that, I'll turn it over to my colleague, Dr. Pamela Rockwell.
Thank you, Dr. Hamed. Hi, my name is Pamela Rockwell, and I wear a couple hats. I am an associate professor of family medicine at the University of Michigan Medical School, and I'm the medical director of Domino's Farms Family Medicine. But I also serve another role with the ACIP, that's the Advisory Committee on Immunization Practices. I completed a fellowship in vaccine science many years ago and then was appointed as a national representative for the American Academy of Family Physicians to go to these meetings at the CDC in Atlanta that normally occur 3 times a year. Well, since the pandemic started, we've had, I think, something like 11 emergency meetings where all the information, data, research on all the COVID vaccines and prioritization recommendations have come through. So I feel fairly versed on the topic. And I too want to urge the state to include family physicians in future allocation of vaccines. Now, I understand how difficult it is with the Moderna, Pfizer, deep freeze requirement vaccines to just be dispersed out to small family physician offices, for instances, who may not have the capability. But now with the new J&J vaccine, the Janssen vaccine that does not require this deep freeze, I strongly urge the state to consider doling out these vaccine allotments to our colleagues in primary care. So this is the one-shot campaign. We know our patients trust us. I can tell you all the medicine I've done during COVID, whether it's virtual medicine, new to me, but I think here to stay, as well as in-person visits. About 1 in 4 to 5 patients, I am discussing COVID vaccination. They have concerns, they have questions. And I don't think there has been a single patient I have spoken with who hasn't said, okay, doc, I'm going to go get the vaccine. So I feel good about that, but that's one person at a time from me. I think if we can expand vaccine allocation to all the family physicians around the state, especially smaller rural communities where the trust in their family physician is so high that they will follow the advice so that we can help to end this pandemic. So a Kaiser survey recently found that 8 in 10 people rely on the advice of their primary care physician on vaccine decision, whether to get the vaccine, any vaccine or not. And we also know that there has been a sharp decline in vaccination for children and adults since the pandemic started. And it's for obvious reasons. People weren't, first we were shut down, then people weren't going to the doctor's office, and some still express fear to go to their doctor's office because they're afraid of contracting COVID-19. But now we're at a risk in a place where less than 50% of our children in the state of Michigan are up to date in their vaccines by 2 years old. We're looking at the potential for future vaccine preventable outbreaks, like something like measles, which would be very devastating. So I want to remind patients that they need to keep up with all their routine vaccinations, but then also consider COVID-19 vaccinations. I can assure everybody all 3 vaccines, whether it's the 2-shot Pfizer Moderna or the 1-shot J&J Johnson & Johnson vaccine, are all equally, and I mean equally, effective at preventing death and preventing severe COVID disease and going into the hospital and needing a ventilator. So whatever vaccine is offered to you first, I urge people to get. In the meantime, until we get vaccines in our primary care offices, every Michigander vaccinated is one day closer to herd immunity for the state. And we still have a long way to go, although the numbers are encouraging with the number of people getting vaccinated every week. Reach out to local pharmacies and to the health department, and through the church groups sometimes are offering mass immunization clinics. But once we get it into our primary care offices, I think we will make an incredible dent to improve vaccination rates. I think that's about all I have to say for now, and I'm going to turn it back to Carlene.
All right. Well, thank you, Dr. Hamed and Dr. Rockwell. As you can see, our physicians are very passionate about this issue and want to help get more shots in arms as soon as possible. With that, we'll open it up for questions. If you have a question, please feel free to type your name and outlet in the chat box. Laura will call on you, and Ken, at that time, please unmute yourself and feel free to ask your question. Again, thank you so much for joining us here today.
Okay, we'll start with Courtney from WYI.
Hello, good morning. Thank you for taking my question. So do you think that by allowing you guys to have the ability to administer these vaccines, will people be more susceptible to get the vaccine?
Do you want to take that, Mark, or I can take?
Go ahead, Dan.
I feel there is a subset of patients who rely on their family physician. I've known some patients for 30 years, and they truly rely on our advice, and it's about trust. And unfortunately, there have been several years of questions on trust and what's coming out through either government or media sources, and family physicians really are a trusted source. So yes, I feel like we would be able to increase the number of Michiganders vaccinated.
Okay, next we've got Steve from Michigan Radio.
Hi, I was just wondering, what are you hearing from MDHHS about transitioning from the current delivery model of mass vaccinations, going back to what we normally have, which is the local physician? Have you heard any input about where they're looking at making that transition back to the traditional delivery form?
I have not, but there is discussion about looking at that transition. I do feel all that was involved with transport and the freezing and the maintenance of the first 2 vaccines, it was almost out of the question for private offices to have these very expensive deep freezers. But now that J&J is becoming more available, yes, there is some talk about looking at that, but no concrete plans that I'm aware of to date.
I'll add on to that too. You know, being over the health departments, I'll tell you, even the Pfizer vaccine health departments is hard to kind of store there because ultra cold temperature needed. So we found better luck with Moderna. Now, physicians currently can enroll to be a COVID vaccine provider. So you'll be on a registry to help be on that list. So once that once it's available to be distributed, hopefully they'll use that list to help guide where to send the vaccines for the patients go.
Okay, next we've got Karen from the Cadillac News.
Thank you. I'm wondering if you could talk about what your objective would be. Like, do you think that family physicians should get all of the state's allotment of the Johnson & Johnson vaccine? And then the other question I have is about attitudes in clinics about the vaccine, not necessarily the family physician, but maybe the nursing staff. I'm hearing locally, there's still some vaccine hesitancy amongst people that are healthcare professionals themselves. And I'm wondering if that can have like the opposite effect of, since they're trusted, if your favorite local nurse isn't getting vaccinated, then what happens?
Well, I definitely feel that the ability to vaccinate our patients would be better understood if we do have the whole team approach towards hesitancy. So I believe earlier on in the pandemic, earlier on when the vaccines came out, there was a lot more hesitancy among healthcare workers. Then we haven't grown third arms yet. My 5G hasn't kicked in, so I think we'll be okay to vaccinate the rest of the staff. So we're seeing less healthcare workers be hesitant, so that's going to be key. As far as which vaccines should go to clinics, I believe it'll be probably a combination of looking to see which clinic has what kind of storage capabilities. We know the J&J vaccine can be stored in a refrigerator, so that's probably going to be where most of the J&J is going to, in my opinion, probably should go. And I'll tell you, at the health departments, we could definitely use the help because our immunization clinics for everything else but COVID has been lagging behind. So we need to get our kids vaccinated for school, our maternal infant wellness clinics open too. So there's a lot more help the health department needs. So by having the family physicians have the vaccines in their offices, it would be a huge burden off the health departments.
And I can address that too a bit because no, I don't feel that all the J&J vaccines should go to private offices. I think our health departments have been doing an incredible job, given the historically understaffed, underpaid condition of the health departments in general over the last decade. But in terms of equity, I think I feel very strongly that only people who have access to the internet or are savvy to know to get on 5 different lists and see who calls them first get the vaccine, because there are many people out there who either don't have internet access or don't have the wherewithal to be able to advocate for themselves. So I think that the J&J vaccine as a one-shot effective vaccine is a wonderful product to go out into the community for folks who may be transient or who may not be able to come back for a second shot or have transportation issues. So yes, private offices and major medical centers can do that as well, but I think the health department needs to be involved with getting vaccine as well.
All right, next we have Eric from 9 and 10 News.
Hello, I was just wondering where do you feel this will be most beneficial? Would it be in rural areas where hospitals and health departments are fewer and far between, or would it be in the urban areas where just demand is so much higher and it gives another outlet to kind of soften that demand?
I would say both, actually, because some of these more rural areas, their health departments have been doing an amazing job and reaching out to people. Once we have enough vaccine, this is a non-issue. The whole issue will be education and letting people know how safe it is and how important it is to get the vaccine. But until we get there, I think having primary care offices have the ability to vaccinate will make it happen quicker.
All right, are there any other questions? All right, then it looks like we're all set for today. Thank you so much for everyone for attending, and let me know if you have any questions for the doctors.
Thank you.
Thank you.
Thank you.